Question 1. In the context of Esther Thompson, a radiographer at a busy metropolitan imaging center, is faced with a situation where a pediatric patient requires a EKIN. Due to the delicate nature of pediatric imaging, Esther Thompson must ensure that radiation exposure is minimized without compromising the diagnostic quality of the images. In addition, he is expected to adhere to the ALARA as low as reasonably achievable principle, which requires balanced approach to dose reduction while achieving optimal image quality. Given the circumstances, what is the most appropriate strategy Esther Thompson should adopt to both minimize radiation dose and maintain diagnostic image quality? The imaging facility also expects adherence to national and international dose guidelines, which have been emphasized in the ASRT Image Wisely campaign certification. Consider factors such as scan protocol adjustments, patient positioning, and the use of dose reduction technology as part of your decision-making process. A. Increase the tube current and use broad scanning parameters to ensure a high-quality image. B. Adjust scan parameters such as lowering the tube current, modulating the dose dynamically based on patient size, and utilizing automatic exposure control while ensuring the diagnostic information is preserved. C. Proceed with standard protocols regardless of patient age, relying solely on post-processing for noise reduction. D. Exclusively on speeding up the scanning process to reduce overall patient time in the scanner. Answer B. Explanation. The ALARA principle is a cornerstone of radiation safety, particularly in pediatric imaging where patients are more sensitive to radiation effects. Option B is correct because it emphasizes the importance of modifying scan parameters, such as reducing the tube current and employing automatic exposure control, which helps balance the necessity of high diagnostic image quality with minimizing radiation dose. This approach aligns with both national and international guidelines and is a key component of the ASRT Image Wisely campaign certification standards. Regulatory bodies have stipulated imaging professionals must use dose optimization techniques to protect patients, especially in sensitive cases, and technology like automatic exposure control ensures that each patient receives the minimal dose necessary for accurate diagnosis. In contrast, the other options fail to prioritize dose adjustment or unnecessarily expedite procedures at the potential expense of image quality and patient safety. This comprehensive approach under ALARA principle is essential for minimizing long-term biological effects and safeguarding patients while still acquiring the critical diagnostic information needed. Question 2. According to recent studies, Ms. Rodriguez, an experienced imaging technologist, is reviewing the imaging protocols at her facility. She notices that the current practice for fluoroscopy procedures has not been updated in years, leading to concerns about potential unnecessary radiation exposure. The facility is participating in the ASRT Image Wisely campaign certification, and Ms. Rodriguez has been tasked with implementing dose minimization techniques. Considering the latest regulatory guidelines and professional recommendations, what approach should Ms. Rodriguez take to ensure the fluoroscopy procedures comply with modern radiation safety standards and reduce unnecessary radiation exposure for both patients and staff? A. Schedule additional fluoroscopy exams to collect more data before making any protocol adjustments. B. Replace fluoroscopy with CT scanning for all procedures to modernize the technique. C. Increase the radiation dose slightly to ensure faster image acquisition and reduce overall exposure time. D. Review and update fluoroscopy protocols by incorporating dose optimization tools, such as real-time dose monitoring, patient-specific adjustments, and reducing frame rates as needed, ensuring adherence to current regulatory and professional safety recommendations. Answer D. Explanation. This question challenges the candidate to apply dose minimization strategies in line with the ASRT Image Wisely campaign certification while also addressing the evolving regulatory and safety guidelines. Option D is the appropriate choice because it emphasizes reviewing current protocols and integrating specific dose optimization techniques such as real-time dose monitoring and patient-specific adjustments. These measures help ensure that the radiation exposure is kept to the minimum necessary while still obtaining diagnostically useful images. Fluoroscopy, if not properly optimized, may expose both patients and staff to unnecessary radiation. Regulatory guidelines continuously evolve, requiring a proactive approach to protocol optimization that includes reducing frame rates and employing advanced dose reduction technologies. In contrast, the other options either delay action, suggest a complete modality change without basis, or increase the dose unnecessarily, potentially compromising patient safety. The thorough review and protocol update suggested in option D align with recommendations and underscore a commitment to continuous quality improvement in radiation protection. Question 3. From the perspective of Dr. Patel, a seasoned radiologist in a community hospital is preparing to evaluate a challenging set of cases that involve multiple imaging modalities. One case involves a high-risk patient who has undergone several diagnostic imaging procedures, resulting in cumulative radiation exposure. Dr. Patel must decide which imaging modality to pursue for subsequent examinations, taking into account both radiation dose and the diagnostic outcome. In this scenario, how should Dr. Patel balance the trade-off between reducing radiation exposure and maintaining diagnostic efficacy, particularly in light of the imaging dose reduction principles mandated by ASRT Image Wisely campaign certification guidelines? Opt for MRI as an alternative modality since it does not use ionizing radiation and, when clinically feasible, can provide high-quality diagnostic information. B. Continue with repeated CT scans but adjust the protocols to slightly reduce the radiation dose. C. Rely solely on ultrasound imaging even when the clinical question may require higher resolution imaging that ET or MRI provides. D. Increase the number of imaging procedures to ensure all possible diagnostic data is captured despite the cumulative exposure. Answer. Explanation. In this scenario, option is the best choice because it directly addresses the need to minimize ionizing radiation exposure while maintaining diagnostic quality. MRI does not use ionizing radiation, thus making it an excellent alternative modality for high-risk patients provided that the clinical indications are appropriate. The ASRT Image Wisely campaign certification emphasizes balancing radiation safety with diagnostic efficacy through appropriate modality selection and dose reduction measures. While adjusting CT protocols can lower the dose option B, it does not eliminate cumulative exposure. Ultrasound option C might not deliver the necessary resolution for all clinical questions, and increasing the number of procedures option D would unnecessarily increase radiation exposure. Therefore, selecting MRI aligns with the dual goals of reducing radiation risk and providing excellent diagnostic outcomes. This decision also reflects an understanding of the broader implications of radiation exposure and demonstrates commitment to safety, which are core to the professional standards outlined in the campaign certification. Question 4. Based on the information, Istali, an experienced imaging professional, is tasked with updating the imaging protocols for his hospital's ET scan department. Recent case studies from the ASRT Image Wisely campaign certification have highlighted the importance of optimizing ET dose indices, including ETA, computed tomography dose index, and DLP, dose length product. Istali's challenge is to implement optimization strategies without compromising image quality. With the rising scrutiny on radiation dose, what actions should Istali consider to achieve balance between diagnostic accuracy and radiation protection? A. Focus solely on increasing patient throughput by shortening scan times. B. Only rely on historical protocols without incorporating new dose reduction technologies. C. Optimize the CT protocols by employing techniques such as iterative reconstruction, reducing scan length, adjusting KVP and according to patient size, and closely monitoring ETI DLP values as recommended in current professional guidelines. D. Continue using the same CT protocols and update only when major equipment upgrade occurs. Answer. C. Explanation. Option C is the most appropriate answer for Istali's scenario. He must manage the balance between maintaining high image quality and reducing radiation dose by employing combination of dose optimization techniques. The use of iterative reconstruction methods has been shown to reduce noise and allow for low radiation dose protocols without sacrificing diagnostic accuracy. Additionally, tailoring scanning parameters such as KVP, ILAVOR, peak, and milliampere to the patient's size and reducing the scan length are proven strategies endorsed by the ASRT Image Wisely campaign certification guidelines. These measures help lower both the CT-DLP, key parameters used to estimate patient radiation exposure. In contrast, increasing patient throughput or relying on outdated protocols does not address the current emphasis on radiation safety. Comprehensive and targeted approach not only meets modern regulatory requirements, but also reflects deep understanding of technological advancements and patient safety principles that are critical in advanced radiology practices. Question 5. When considering the responsibilities of imaging professionals in ensuring patient safety, Ms. Nguyen, a radiologic technologist, finds herself reviewing the facility's nuclear medicine protocols. The facility has recently embraced the ASRT Image Wisely campaign certification, which stresses the importance of minimizing radiation exposure while preserving diagnostic quality. Ms. Nguyen must identify potential areas where adjustments can be made to optimize radiopharmaceutical activity without compromising image accuracy. Given the multifactorial considerations in nuclear medicine, which approach best aligns with the established dose reduction principles and the professional guidelines outlined in the campaign, they increase the administered radiopharmaceutical activity to achieve quicker imaging times. B. Eliminate nuclear medicine exams where possible and substitute them with CT scans. C. Continue with the current standard dose regardless of patient-specific factors. D. Evaluate and modify the radiopharmaceutical dosing protocols by considering patient weight and clinical indications, implementing dose reduction strategies when feasible while ensuring that image quality remains sufficient for diagnostic purposes. Answer D. Explanation. In nuclear medicine, as in other imaging modalities, patient-specific factors such as weight and clinical condition are crucial in determining the optimal radiopharmaceutical dose. Option D is correct because it emphasizes a tailored approach to dosing that aligns with the dose reduction principles promoted by the ASRT Image Wisely campaign certification. By adjusting doses based on individual patient characteristics and clinical indications, imaging professionals can minimize unnecessary radiation while still capturing diagnostically accurate images. This strategy is backed by professional recommendations in international guide that advise customization of protocols rather than applying a one-size-fits-all approach. Increasing the dose option A or uncritically sticking to standard doses option C can lead to unnecessary exposure, while entirely substituting the procedure option B may not be clinically appropriate. Thus, option D demonstrates an advanced understanding of how to balance radiation safety with the need for high-quality diagnostic imagery, ensuring patient safety and clinical efficacy are maintained concurrently. Question 6. With respect to Mr. Green, a veteran imaging specialist who is in charge of quality assurance at a large outpatient diagnostic imaging center, a recent internal audit has revealed inefficiencies in patient communication regarding imaging procedures. The audit, conducted under the guidelines of the ASRT Image Wisely campaign certification, has shown that patients often express concerns about radiation exposure and lack clear understanding of the benefits versus the risks of imaging. What is the most effective strategy Mr. Green should implement to enhance communication with patients, thereby improving their understanding and acceptance of the necessary imaging procedures? A. Disregard patient concerns and focus strictly on technical improvements. B. Develop and implement a structured communication plan that includes detailed, easily understandable explanations of radiation risks and benefits, tailored to different patient demographics, while also integrating visual aids and standardized educational materials as recommended by the ASRT guidelines. C. Provide patients with technical manuals and registers to review independently. D. Rely solely on online resources without any personalized consultation, expecting patients to interpret the information themselves. Answer B. Explanation. Effective communication is essential in alleviating patient concerns, particularly in the context of radiation exposure. Option B is correct because it advocates for a structured and personalized communication plan that clearly articulates the benefits and potential risks of imaging procedures. Detailed explanations, visual aids, and standardized educational materials help demystify technical concepts and ensure that patients are well informed. The ASRT Image Wisely campaign certification emphasizes that imaging professionals should not only optimize radio dose but also engage in proactive communication with patients. Tailoring the message to suit different demographic groups makes the information accessible, builds trust, and then reinforces the commitment to patient safety. In contrast, the other options either neglect patient needs or provide overly technical information that may be misinterpreted. By adopting a comprehensive communication strategy, Mr. Green can bridge the gap between radiology language and patient understanding, thereby fostering a safer, more informed imaging environment that aligns with the highest professional standards. Question 7. Throughout the course of his career, Dr. Washington, a respected radiologist, has encountered several instances where outdated imaging protocols have led to unnecessary radiation exposure for patients. Recently, as part of his institution's commitment to the Asset Image Wisely campaign certification, he was asked to critically assess current imaging protocols to identify areas for improvement. With the dual mandate of enhancing image quality, reducing radiation dose, which strategy should Dr. Washington prioritize when reviewing and optimizing the protocols? A. Systematically review and update the imaging protocols by integrating dose reduction technologies such as iterative reconstruction and automatic exposure control, and by ensuring compliance with current radiation safety guidelines, thereby directly contributing to patient safety and aligning with the Image Wisely campaign's long-term objectives. B. Preserve existing protocols to avoid potential legal repercussions from frequent changes. C. Focus exclusively on acquiring new imaging equipment instead of reviewing existing protocols. D. Maintain the status quo and postpone review until scheduled equipment upgrade occurs. Answer A. Explanation. Dr. Washington's scenario exemplifies the need for proactive and systematic protocol optimization. Option is the ideal response because it supports an ongoing review and enhancement process that integrates modern dose reduction technologies. Techniques such as iterative reconstruction and automatic exposure control are widely recognized for their ability to lower radiation dose without compromising diagnostic quality. By aligning protocol updates with current radiation safety guidelines and industry best practices, imaging professionals not only meet regulatory standards but also directly contribute to improved patient outcomes. In contrast, simply maintaining outdated protocols or delaying improvements increases the risk of cumulative radiation exposure, which runs contrary to both patient safety and the Image Wisely campaign's core objectives. The strategic review of protocols also facilitates continuous quality improvement. Critical aspect of advanced practices. Dr. Washington's comprehensive approach ensures adherence to the latest recommendations while effectively addressing the dynamic challenges associated with modern diagnostic imaging, emphasizing the importance of meticulous quality assurance. Question 8. When analyzing a recent case at a leading urban hospital, Ms. Simmons, a board-certified radiologic technologist, discovered that a patient with a complex medical history had undergone multiple imaging procedures, including CT and nuclear medicine exams. With concerns about cumulative radiation exposure, the hospital's imaging department is investigating potential improvements in dose registries and adherence to the radiation reduction principles highlighted in the Asset Image Wisely campaign certification. What should be the primary focus in establishing an effective dose registry system to optimize patient safety and regulatory compliance? A. Recording only the patient's name and date of birth for legal documentation. B. Developing comprehensive dose registry system that monitors radiation exposure for each patient, incorporates dose indices such as E to DI DLP, integrates with electronic health records, and includes alerts for high cumulative doses in order to identify trends and facilitate timely interventions. C. Limiting the dose registry to CT exams and ignoring other modalities. D. Relying solely on manual data entry, which may lead to errors and inconsistencies. Answer correction. B. Explanation continued. The creation of a robust dose registry is critical as it plays a key role in preventing the risk of radiation overexposure by ensuring that every imaging procedure is recorded accurately. Dose registries provide actionable data that can prompt review and adjustment of imaging protocols before patient safety is jeopardized. Integrating modern digital technologies improves accuracy, reduces the probability of errors, and helps maintain consistency across various imaging modalities. In the evolving landscape of radiologic technology and patient care, a well-designed dose registry is a fundamental component that supports not only regulatory compliance but also continuous quality improvement in the practice of diagnostic imaging. Question 9. Under the assumption that Mr. Taylor, the chief radiographer at a regional hospital, must decide on the optimal imaging modality for a patient with a suspected musculoskeletal abnormality, he faces a choice between conventional radiography and MRI. The Asset Image Wisely campaign certification underscores the significance of balancing radiation exposure with diagnostic benefit. considering that MRI offers the advantage of no radiation but may have limitations in availability and cost, what factors should ISTA Taylor consider when choosing the best imaging option to ensure both patient safety and diagnostic accuracy? A. Prioritize radiography exclusively since it is always more cost-effective than MRI regardless of patient risk factors. B. Choose MRI every instance as it completely eliminates radiation exposure regardless of clinical circumstance. C. Assess both the clinical presentation and patient-specific factors such as age, history of radiation exposure, and the urgency of the diagnosis while considering the inherent advantages of lack of ionizing radiation and radiography's accessibility in order to make an informed decision that balances radiation risk with diagnostic requirements. D. Elect for neither modality and refer the patient to another institution for further evaluation. Answer. C. Explanation. This scenario demands a nuanced decision-making approach where the imaging professional weighs several factors to select the most appropriate diagnostic modality. Option C is correct because it requires the radiographer to evaluate both the clinical details of the patient's presentation and the pros and cons of each imaging method. MRI, while advantageous in that it avoids ionizing radiation entirely, may not always be readily available or cost-effective, particularly in urgent clinical situations. On the other hand, conventional radiography is widely accessible and efficient but does involve exposure, ionizing radiation. By factoring in patient age, cumulative radiation exposure, and the urgency of the diagnostic need, ISTA Taylor can align his decision with the dose reduction and patient safety principles promoted in the Asset Image Wisely campaign certification. His balanced approach, which considers both modality strengths and limitations, reflects deep understanding of modern diagnostic imaging challenges. It underscores the importance individualized patient care through comprehensive risk-benefit analysis, ultimately leading to safer, more effective imaging practices. Question 10. Considering the evidence in recent quality improvement initiatives, is Carter, a quality assurance manager at a multi-site imaging center, is responsible for ensuring that imaging protocols across all sites adhere to best practices as prescribed by the Asset Image Wisely campaign certification. A current project involves conducting a thorough review of imaging protocols to identify and remedy any inconsistencies in radiation dose management, cross-CT, fluoroscopy, and nuclear medicine departments. What is the most critical step his Carter should take to implement an effective continuous quality improvement program that aligns with current regulatory and professional radiation safety standards? A. Organize a one-time training session for staff without establishing ongoing monitoring processes. B. Develop and implement a comprehensive data-driven quality assurance program that includes regular audits, protocol reviews, staff training updates, and the integration of automated dose tracking systems to monitor compliance and identify opportunities for dose reduction across modalities. C. Delay any changes until a regular violation occurs to avoid unnecessary expenses. D. Focus exclusively on upgrading imaging equipment without addressing protocol consistency or staff education. Answer. B. Explanation. Option B is the ideal response because it encapsulates the essence of a continuous quality improvement CQI program that is data-driven and involves regular reviews across multiple imaging modalities. Ms. Carter's role as quality assurance manager requires her not only to update protocols but also to establish a sustainable system of ongoing monitoring, auditing, and education. The comprehensive approach described in Option B involves periodic audits and the integration of automated dose tracking systems, all of which are essential to ensure that the imaging center adheres to both the Asset Image Wisely campaign certification requirements, broader regulatory guidelines. Such systematic program promotes transparency, enables the early detection of protocol inconsistencies, and facilitates proactive adjustments to reduce radiation exposure without compromising diagnostic accuracy. In addition, ongoing staff training ensures that all personnel are up to date with the latest radiation safety standards and technological advancements. By engaging in these continuous improvements, Ms. Carter not only enhances patient safety but also fosters culture of excellence and accountability in line with professional and regulatory standards. Question 11. In the context of radiation interaction with matter, a medical physicist is assessing a new imaging technique that uses high-energy X-rays for diagnostic purposes. He wants to understand how these X-rays interact with different types of tissues in the body. What principle should the physicist apply to ensure minimal harmful effects on the patient's tissues during the imaging process? A. The law of reciprocity. B. The ALARA principle. C. The inverse square law. D. The dose-response relationship. Answer. Correct answer B. ALARA principle explanation. The ALARA, as low as reasonably achievable, principle is central to ensuring minimal radiation exposure to patients while maintaining diagnostic image quality. It emphasizes optimizing radiation doses by considering factors such as imaging parameters and the necessity of imaging. The law of reciprocity A and the inverse square law C apply to specific contexts of radiation. ALARA is the most comprehensive principle for patient safety in imaging. The dose-response relationship D explains how radiation dose impacts biological effects but does not directly ensure dose optimization in imaging. Question 12. Given the circumstances of a recent patient undergoing a chest X-ray, the radiologist is considering the best method for reducing radiation exposure. The patient has a history of frequent imaging, which increases the concern about cumulative radiation dose. What strategy should the radiologist implement to reduce radiation exposure to the patient while maintaining diagnostic quality? A. Increase the kilovoltage AVP to improve image contrast. B. Use a higher dose of radiation to reduce noise in the image. C. Apply dose reduction techniques such as using appropriate shielding and collimation. D. Use a longer exposure time to ensure better resolution. Answer. Correct answer C. Apply dose reduction techniques such as using appropriate shielding and collimation. Explanation. To minimize radiation exposure, the radiologist should use techniques like appropriate shielding, collimation, and reducing unnecessary exposure. Increasing the kVPA can reduce dose but may alter contrast, and using a higher dose of radiation B is counterproductive to dose reduction. Longer exposure times D increase patient dose without improving image quality and may lead to motion artifacts. Question 13. As demonstrated by the growing awareness of the Image Wisely campaign, there is a focus on reducing radiation exposure in pediatric imaging. A pediatric radiologist is preparing to perform a scan on a child. What is the most appropriate step to take to minimize radiation exposure during the scan? A. Use the standard adult protocol and adjust the image processing afterward. B. Use pediatric-specific protocols to reduce radiation dose. C. Decrease the image quality to minimize the dose further. D. Avoid the use of contrast agents to reduce dose. Answer. Correct answer B. Use pediatric-specific protocols to reduce radiation dose. Explanation. Pediatric patients are more sensitive to radiation, so it is critical to use pediatric-specific protocols that optimize imaging parameters for low radiation doses while maintaining diagnostic quality. Using adult protocols A would expose the child to unnecessarily high doses, decreasing image quality. C may compromise diagnostic utility, and avoiding contrast agents D does not inherently reduce the radiation dose but may compromise the diagnostic purpose of the imaging. Question 14. During the process of evaluating a fluoroscopic procedure, a radiologist is tasked with ensuring that the radiation dose to both the patient and the healthcare staff is minimized. What actions should be prioritized to achieve this goal in a fluoroscopic procedure? A. Reduce the fluoroscopy time as much as possible. B. Increase the radiation dose to improve image resolution. C. Ensure that the patient is always in the center of the field of view. D. Use lead shielding for the healthcare staff only. Answer. Correct answer A. Reduce the fluoroscopy time as much as possible. Explanation. The fluoroscopy time should be minimized because prolonged exposure leads to higher radiation doses. Increasing the radiation dose B is counterproductive to minimizing exposure. Ensuring proper positioning of the patient C is important for image quality but not directly related to radiation dose reduction. Using lead shielding D is crucial for healthcare staff, but it is not the most effective way to reduce patient exposure, which can be controlled primarily by reducing fluoroscopy time. Question 15. The growing trend in imaging safety highlights the need for radiation dose optimization, especially in computed tomography. See, a hospital's radiology department has adopted the Image Wisely campaign's principles when performing AK of the abdomen. The technologist should adjust the imaging parameters to balance image quality with radiation dose. What should be the priority consideration when determining the optimal parameters for the scan? A. Increasing the milliampere seconds mass to ensure adequate image quality. B. Decreasing the slice thickness to increase image resolution. C. Reducing the radiation dose while maintaining diagnostic image quality. D. Using the highest possible kilovolt peak (kVp) to increase penetration power. Answer. Correct answer C. Reducing the radiation dose while maintaining diagnostic image quality. Explanation. The primary goal is to use the least amount of radiation necessary to achieve the required diagnostic image quality. Increasing mass A and kVp D could unnecessarily increase dose while decreasing slice thickness B may not significantly improve image quality and could lead to higher radiation exposure. Optimizing dose while maintaining image quality is in line with the Image Wisely campaign's objectives. Question 16. To determine the efficacy of a dose reduction strategy, a radiologist is evaluating the CT dose indices ETI and dose length product DLP for different protocols when considering the effectiveness of a dose reduction technique. Which of the following indices is most useful for assessing the patient's radiation exposure during CT exam? A. ETI DLP, B. BER and ALARA, C. DLP and mass, E. ETI and AE. Answer. Correct answer A. TDI DLP. Explanation. ETI computed tomography dose index and ELP dose length product are the primary indices used to quantify the radiation dose in A. ETR measures the dose delivered to the patient during one rotation of the CT scanner, while DLP accounts for the total radiation exposure across the entire scan. BERT B and ALARA B are principles but not indices, while mass C and kVp D are parameters affecting dose but are not indices to directly measure radiation exposure. Question 17. Considering the evidence on radiation safety, a hospital wants to implement quality improvement measures based on the Image Wisely campaign's goals. One of the strategies includes ongoing review and optimization of imaging protocols. Which of the following steps would be most effective in improving radiation safety and reducing unnecessary patient exposure? A. Standardizing imaging protocols across all patients. B. Reviewing imaging protocols regularly and adjusting for dose reduction. C. Increasing radiation doses to improve diagnostic image clarity. D. Encouraging patients to wear more lead aprons during procedures. Answer. Correct answer B. Reviewing imaging protocols regularly and adjusting for dose reduction. Explanation. Regularly reviewing and optimizing imaging protocols is crucial for minimizing radiation exposure while ensuring diagnostic quality. Standardizing protocols A without adjusting for patient needs may result in unnecessary exposure. Increasing radiation doses C would not align with the goal of reducing exposure. Wearing aprons D. Does not address the radiation dose received by the patient during the imaging procedure. Question 18. The Image Wisely campaign targets various stakeholders to promote radiation safety. A radiology department wants to enhance its understanding of how to communicate radiation safety information effectively to patients. What is the best practice for the department when addressing patients' concerns about radiation exposure during imaging procedures? A. Provide detailed technical explanations of radiation dosages. B. Reassure patients by emphasizing that radiation exposure is always safe. C. Use simple, non-technical language to explain the necessity of imaging and the efforts to minimize radiation exposure. D. Focus primarily on the risks without explaining the benefits of the imaging procedure. Answer. Correct answer C. Use simple, non-technical language to explain the necessity of imaging and the efforts to minimize radiation exposure. Explanation. When communicating with patients, it is important to use clear, non-technical language that addresses their concerns while explaining the necessity of imaging and the steps taken to minimize radiation exposure. Providing overly technical explanations might confuse patients. Reassuring patients That radiation is always safe is misleading and focusing only on risks. D. Could create unnecessary anxiety without providing a balanced perspective. Question 19. Upon closer examination, a radiology technologist is reviewing a patient's previous CT scans and is concerned about a potential increase in the patient's cumulative radiation exposure over time. What should be the technologist's priority to mitigate future radiation exposure in light of the Image Wisely campaign's guidelines? A. Use the lowest possible radiation dose consistent with achieving diagnostically adequate image. B. Encourage the patient to undergo frequent imaging to monitor any changes. C. Increase the scan parameters to improve image quality across all exams. D. Avoid the use of contrast agents to reduce radiation exposure. Answer. Correct answer. A. Use the lowest possible radiation dose consistent with achieving a diagnostically adequate image. Explanation. To reduce cumulative radiation exposure, the technologist should aim to use the lowest possible dose while ensuring that the image remains diagnostically useful. Encouraging frequent imaging. B. Would increase exposure, increasing scan parameters. C. Could unnecessarily raise the dose. Avoiding contrast agents does not directly reduce radiation exposure but could compromise the diagnostic utility of the scan. Question 20. In response to increasing public concern about radiation safety, a hospital adopts the principles of the Image Wisely campaign. A radiologic technologist is preparing for a fluoroscopy exam on an adult patient. What is the best practice to ensure the patient's radiation dose is minimized while maintaining diagnostic quality? A. Use the lowest radiation dose possible while adjusting the exposure time for image quality. B. Perform the fluoroscopy without adjusting the radiation settings for each patient. C. Increase the exposure time to improve the clarity of the image. D. Use a higher radiation dose to ensure a sharp and clear image. Answer. Correct answer. A. Use the lowest radiation dose possible while adjusting the exposure time for image quality. Explanation. To minimize patient exposure, it is important to use the lowest radiation dose possible while ensuring diagnostic quality by adjusting exposure time appropriately, performing the exam without adjusting the settings. B. Or increasing the exposure time. C. Would unnecessarily increase radiation dose. A higher radiation. D. Is not necessary for achieving a clear image if dose optimization techniques are applied. Question 21. During a routine CT scan, the technologist notices the patient is positioned incorrectly, which could potentially lead to unnecessary radiation exposure. What is the most appropriate action for the technologist to take in order to minimize patient radiation dose while ensuring diagnostic image quality? A. Proceed with the scan and adjust the positioning after the initial scan. B. Stop the scan immediately and reposition the patient before beginning the procedure. C. Continue the scan as is and compensate with a higher dose to achieve better image quality. D. Use a low radiation dose setting to offset the positioning issue. Answer. Correct answer. B. Stop the scan immediately and reposition the patient before beginning the procedure. Explanation. Proper patient positioning is essential to minimize unnecessary radiation exposure and ensure diagnostic quality. The scan should be stopped immediately and the patient should be repositioned to avoid additional exposure or image degradation. Increasing the dose C or using a lower dose D would not compensate for poor positioning, result in suboptimal imaging. Adjusting after the initial scan is not advisable due to the potential risks of additional exposure. Question 22. In preparation for a fluoroscopic procedure, a radiologist wants to reduce the radiation exposure to both the patient and the healthcare staff. What is the most effective way to achieve this goal while maintaining imaging accuracy? A. Use higher radiation doses to improve image resolution. B. Increase the fluoroscopy time to ensure a clearer image. C. Employ the lowest possible radiation dose by adjusting fluoroscopy settings, using proper shielding, and reducing exposure time. D. Limit the number of images taken even if it compromises diagnostic quality. Answer. Correct answer. C. Employ the lowest possible radiation dose by adjusting fluoroscopy settings, using proper shielding, and reducing exposure time. Explanation. Minimizing exposure while ensuring diagnostic accuracy can be achieved by adjusting fluoroscopy settings to use the lowest radiation dose possible. using lead shielding for protection and reducing fluoroscopy time. Increasing the dose A or exposure time B would increase radiation. Limiting images D without considering the diagnostic requirements could compromise patient care. Question 23. A patient is scheduled for a mammogram and the radiologic technologist is reviewing the image wisely guidelines to minimize radiation exposure. What is the most important consideration in achieving a balance between radiation dose and image quality during the procedure? A. Use the highest possible radiation dose to achieve the best image quality. B. Decrease the radiation dose to the lowest level that still allows for a diagnostic image. C. Use a shorter exposure time to reduce patient dose even if it affects image quality. D. Apply a higher kilovolt peak (kVp) to penetrate dense tissues without considering the dose. Answer. Correct answer. B. Decrease the radiation dose to the lowest level that still allows for a diagnostic image. Explanation. The principle of a lower as low as reasonably achievable guides the approach to minimizing radiation dose while maintaining sufficient image quality. Using the highest dose A or increasing kVp D unnecessarily increases radiation exposure. Decreasing exposure time C may compromise image quality. Finding the balance at the lowest possible dose is the most effective approach. Question 24. A hospital is revising its imaging protocols for pediatric patients in line with the Image Wisely campaign's objectives. What is the most appropriate action to take when creating protocols for pediatric imaging to ensure minimal radiation exposure? A. Use standard adult imaging protocols with adjustments for patient size. B. Increase the kilovolt peak (kVp) for all pediatric patients to ensure image clarity. C. Develop specific pediatric protocols that account for the reduced radiation sensitivity of younger patients. D. Eliminate the use of contrast agents to avoid increasing radiation exposure. Answer. Correct answer. C. Develop specific pediatric protocols that account for the reduced radiation sensitivity of younger patients. Explanation. Pediatric patients are more sensitive to radiation, so developing specific imaging protocols tailored to their size and needs is crucial for minimizing exposure while ensuring diagnostic quality. Using adult protocols, A. would expose pediatric patients to unnecessarily high doses. In kVp, B. might improve image clarity but would also increase the radiation dose. Eliminating contrast agents, D. does not directly reduce radiation exposure and could compromise the diagnostic value. Question 25. During a routine chest X-ray, a radiologic technologist notices that the patient is pregnant. To minimize the radiation dose to the fetus, what action should the technologist take? A. Increase the dose to compensate for potential image quality loss. B. Reassess the necessity of the X-ray and consider alternative imaging methods. C. Proceed with the X-ray but shield the abdomen with a lead apron. D. Use a lower exposure time to minimize the dose regardless of image quality. Answer. Correct answer. B. Reassess the necessity of the X-ray and consider alternative imaging methods. Explanation. In the case of a pregnant patient, the technologist should reassess the need for the X-ray and consider alternative imaging methods such as ultrasound, which do not use ionizing radiation. If an X-ray is necessary, shielding the abdomen C can help, but reconsidering the imaging method B is the most effective way to minimize exposure. Question 26. The technologist is performing a scan and needs to adjust the settings to optimize the radiation dose. Which of the following changes will most effectively reduce the patient's radiation exposure without sacrificing image quality? A. Increase the mass setting to improve image resolution. B. Use thinner slice thickness to improve image resolution and reduce dose. C. Reduce the mass and use appropriate scan parameters tailored to the patient's size. D. Increase the kVp setting to penetrate dense tissues. Answer. Correct answer. C. Reduce the mass and use appropriate scan parameters tailored to the patient's size. Explanation. Reducing the mass and adjusting the scan parameters based on the patient's size is the most effective strategy to reduce radiation exposure while maintaining diagnostic image quality. Increasing mass A with kVp D increases the dose unnecessarily, while thinner slice thickness B improves image resolution. It can also increase the so balanced approach is needed. Question 27. The hospital is reviewing its imaging practices to ensure they align with the principles of the Image Wisely campaign. A radiologic technologist is considering the best way to optimize fluoroscopic procedures. What should be the technologist's primary focus when setting up fluoroscopic exam? A. Use the highest possible radiation dose to improve image clarity. B. Minimize fluoroscopy time and adjust settings to maintain diagnostic image quality. C. Maximize exposure time to ensure accurate imaging. D. Use fluoroscopy only when absolutely necessary, regardless of the clinical need. Answer. Correct answer. B. Minimize fluoroscopy time and adjust settings to maintain diagnostic image quality. Explanation. To minimize radiation exposure during fluoroscopic procedures, the technologist should reduce fluoroscopy time and adjust settings to achieve diagnostic image quality with the lowest possible dose. Maximizing exposure time, C, or using the highest dose, A, unnecessarily increases radiation. Limiting fluoroscopy use is not appropriate when the procedure is clinically necessary. Question 20. The hospital has implemented a new policy in line with the Image Wisely campaign, emphasizing dose reduction in pediatric imaging. What is the best approach for imaging pediatric patients to ensure minimal radiation exposure? A. Apply standard adult imaging protocols for all pediatric patients, adjusting only for size. B. Use the lowest possible radiation dose while adjusting for the specific diagnostic needs of the pediatric patient. C. Avoid using radiation altogether, even if it means foregoing important diagnostic imaging. D. Increase radiation exposure to ensure optimal image quality in pediatric patients. Answer. Correct answer. B. Use the lowest possible radiation dose while adjusting for the specific diagnostic needs of the pediatric patient. Explanation. Pediatric patients are more sensitive to radiation, so the dose should be minimized while ensuring sufficient image quality for the diagnostic task at hand. Using adult protocols, A, is inappropriate for pediatric patients. Avoiding radiation altogether, C, might compromise diagnostic outcomes, and increasing the dose, D, is contrary to the principles of the Image Wisely campaign. Question 29. A radiologist is reviewing a series of chest X-rays for a patient who has had several imaging procedures over the past few years. What is the most appropriate action to ensure the patient's radiation exposure remains within safe limits? A. Increase the number of X-ray exams to monitor the patient's condition more closely. B. Reassess the patient's history and only perform necessary imaging, ensuring proper justification for each procedure. C. Reduce the radiation dose by cutting corners on image quality. D. Use advanced imaging techniques regardless of the radiation dose. Answer. Correct answer. B. Reassess the patient's history and only perform necessary imaging, ensuring proper justification for each procedure. Explanation. To minimize cumulative radiation exposure, it is important to reassess the need for each imaging procedure and ensure that only necessary exams are performed, following the principle of justification. Increasing the number of exams, A, could unnecessarily increase exposure and reducing image quality. C, or using advanced techniques. D, without considering the patient's needs, would compromise safety and diagnostic value. Question 30. A radiologic technologist is conducting an abdominal X-ray and wants to ensure radiation safety for both the patient and staff. Which of the following is the most effective strategy to reduce radiation exposure during this procedure? A. Use the lowest possible radiation dose that still provides adequate diagnostic quality. B. Increase the radiation dose to improve image clarity and reduce retakes. C. Have the patient wear a lead apron to protect from scatter radiation. D. Increase exposure time to ensure clearer images. Answer. Correct answer. A. Use the lowest possible radiation dose that still provides adequate diagnostic quality. Explanation. Using the lowest possible radiation dose while maintaining diagnostic image quality is the most effective strategy for minimizing exposure. Increasing the dose, B, or exposure time, D, unnecessarily increases radiation, while wearing a lead apron, C, helps protect the patient from scatter radiation. It directly affects the amount of radiation used for the procedure.